Tracking Arizona's opioid crisis, an average of 5 Arizonans a day are dying from an overdose.
ABC 15 has been covering the opioid epidemic extensively, sharing stories of families devastated after losing people they love.
I feel like a piece of me is gone.
Alexander only took one pill, and that single pill had enough fentanyl in it to kill 4 people.
It's hard to talk about without getting emotional. He was really remarkable.
Opioids can come in a lot of different forms, from prescription drugs like Oxycontin to heroin and fentanyl. All opioids are highly addictive because they trigger the release of endorphins, which create a temporary but powerful sense of well-being. Illegally manufactured fentanyl is one of the deadliest street drugs, with only 2 milligrams. That's roughly 15 grains of table salt, enough to kill you. Anyone who comes in contact with it outside of a hospital is at risk. A life-saving drug that reverses an opioid overdose is now available over the counter, but knowing how to use it properly is critical.
Yeah, this could really change things. And ABC 15's Faye Frederick shows us the free training being offered right here in the Valley.
$13 million worth of illegal drugs seized in Tempe last month. More than 400,000 pills confiscated in Avondale a few months earlier.
Each of those is potentially a life. That's your neighbor, a friend, a relative. So every pill counts.
Opioid reversal medications like Narcan can save a life in seconds if you know how to use it.
You're going to put it up the nose until your fingertips touch the top of the nose. You push the plunger up. Hold for 5 to 10 seconds so all the medication goes inside.
Former firefighter and paramedic Dave Shad says everyone should have it on hand, but warns the medication does expire and it needs to be stored at between 60 and 97 degrees. So don't leave it in your car in the summer sun.
How do you know if it's working?
It should revive somebody in hopefully 15 seconds, but Narcan is sensitive. It also is based on how much opioids are in the system. You statistically are going to have to use 2 doses. What you're going to do is you're going to wait 2 to 5 minutes, make sure it's working. If it's not, you're going to have to give the second dose.
Shad adds it only works on opioids. Think fentanyl, pain pills, morphine, and the like. It does not work on cocaine, meth, and ecstasy. Signs of opioid use include severely constricted pupils, like pinpoints.
Is it possible to overdose someone on Narcan?
No. There's no evidence in the world that shows that Narcan has ever hurt anybody.
But Chad says patients treated with Narcan often vomit and can become combative. So he recommends turning them on their side into what he calls a recovery position.
Right hand to left cheek. Right knee up, rotate, he's stable. He will not roll back over.
And if they vomit, they won't choke. Terros Health offers free Narcan training for individuals and companies available through their website, terroshealth.org. Faye Fredericks, ABC 15, Arizona.
Now, keep in mind, even with Narcan on hand, experts still want you to always call 911 first. Stay on the line with them as you administer the drug. And if you or someone you know is struggling with opioid use, the OAR hotline is free. It's available 24/7. The number is there on your screen, 1-888-688-4222. You can also see much more of our coverage into Arizona's fentanyl crisis. It's on abc15.com/in-depth.